We'll look at what a counselling session actually looks like in practice. Many people have a general idea of counselling, but very little sense of how a session is structured or what typically happens within it. This episode is intended to provide a clear, realistic overview without assumptions or prior knowledge. A session usually takes place within a timed frame. Most sessions last around 50 minutes to an hour maximum, although this can vary depending on setting and context. The session begins and ends at agreed time, which creates a clear boundary around the work being done. The boundary is not arbitrary, it allows the conversation to have focus and containment rather than drifting into everyday discussion. Within that time, the structure of a session is often less rigid than people expect. Counseling does not usually follow a script or agenda in the way of a meeting. Instead, the session is shaped by what feels most relevant to bring into the space on that day by the client. That does not mean the session is unstructured. The structure comes from the relationship, the focus on internal experience, and the role of the therapist in holding attention on what matters. Typically, a session begins with a brief settling in. This may involve checking how the client is arriving into the space or picking up from where the previous session ended. This opening is not about small talk, it helps establish continuity across sessions. As a session unfolds, the therapist's role is to listen carefully and guide attention, rather than direct the conversation towards solutions. The focus is often on how experiences are being understood and responded to, rather than on the events alone. Silence can be part of this process. Silence in counselling is not a gap to be filled, but a space that allows thoughts and feelings to emerge more clearly. Different approaches use silence in different ways, but is generally treated as meaningful rather than awkward. Counseling sessions are collaborative but not symmetrical. The therapist is responsible for maintaining the frame of the session, including boundaries, focus, and ethical standards, whereas the client brings their experience, questions, and areas of uncertainty. Importantly, a counseling session is not a performance. There is no expectation to speak in a particular way, reach conclusions, or make progress within a single meeting. Sessions can feel reflective, practical, exploratory, or quiet, depending on what is being worked with at the time. Over time, sessions develop a rhythm. Themes may reoccur, certain topics may return in different forms. This repetition is part of how understanding deepens and shifts. A single session rarely stands alone. Counseling is best understood as a process that unfolds across multiple meetings, with each session contributing to a broader arc of the work. Understanding what a counseling session actually looks like helps demystify the process. It clarifies what counseling is designed to offer and sets realistic expectations about how that work is carried out. In the next episode, we'll build on this by looking more closely at the therapist's role within that structure and what professional responsibilities sit on that side of the relationship. That's the scope of this episode. Each episode focuses on one specific element, and this was it. We'll leave it there for now and move on in the next episode.